Yes. Okay. Hello, everyone. My name is Sandra Alexander, and I am the project manager for Circular Clinical Care, which is a project by the Canadian Coalition for Green Healthcare being undertaken with the financial support of Environment and Climate Change Canada. And I would like to welcome you on behalf of our team to our opening webinar for Plastics Reduction Week. So to officially start Plastics Reduction Week, I would like to introduce the Coalition's Executive Director, Dr. Miles Sargent, to share a welcome message.
Thank you, Sandra, and hello, everyone, and thank you for joining us today. On behalf of our entire team at the Canadian Coalition for Green Healthcare, as a charity dedicated to advancing sustainable practices in healthcare across the country, we are excited to bring together so many passionate professionals, innovators, and leaders for the important conversations happening every day this week through Plastics Reduction Week. Single-use plastics are woven into nearly every aspect of healthcare, yet we know that much of the waste can be reduced or the practices can be redesigned without compromising safety or quality of care. Today's webinar is an opportunity to explore evidence-based strategies and potential.
Oh, I think he cut out.
Day as a part of the healthcare workforce, and for your commitments to driving meaningful change, inspiring session.
Okay. So I think Dr. Sargent's Wi-Fi is cutting out because he is actually joining us from his rounds in the hospital.
Okay, I do want
So
me to back in. Do you remember the last thing I said? Okay, I'll
no.
try again, Sandra. You ready?
Okay. Sounds good.
Single-use plastics are woven into nearly every aspect of healthcare, yet we know that much of the waste can be reduced or the practices be redesigned without compromising safety or quality of care. Today's webinar is an opportunity to explore evidence-based strategies and potential solutions, ones that not only lessen environmental impact, but also strengthen resilience, efficiency, and long-term value across our health systems. Thank you to all who act as champions in this space. We appreciate the work you do every day as part of the healthcare workforce and for your commitment to driving meaningful change. We're grateful to have you with us, and we look forward to a productive and inspiring session. And I'll hand it back now to Sandra Alexander.
Thank you. So again, to echo Dr. Sargent, we are very grateful to have such a diverse group of clinicians, leads, researchers, and industry partners watching the webinar today, representing an audience across various institutions located across 4 continents and in over 10 countries, which really highlights the commitment to identifying opportunities to reduce single-use plastic waste in healthcare. So while the Circular Clinical Care team acknowledges that plastics play an important role in patient safety and infection control, we also believe there are various opportunities to promote a circular economy and more resilient supply chains without compromising quality of patient care. So during this webinar, we will explore the exponential growth of single-use plastic waste generated by the healthcare sector, which led to the launch of the Circular Clinical Care Single-Use Plastics Reduction Project. We will explore strategies with Jacqueline McNeil for implementing reusables through the Cascades Reusable First Playbook. And then we will explore the repository being built by the Circular Clinical Care team, which currently sits at 253 unique opportunities for plastics reduction, which will be a conversation led by the project's research associate, Tipu Islam. So we are very excited to dive into these solutions with you, and we encourage your questions and ideas throughout the session using the chat and Q&A function. So with that, let's get started. So the project manager in me likes to start by defining things. So defining what plastic is. The sheer magnitude of these synthetic materials in the healthcare sector is outstanding. Why? Because plastic is such a broad umbrella term that the diversity of what their polymer composition is allows them to be malleable and versatile. And versatility is incredibly valuable in healthcare. And plastics offer exactly that, materials that can be shaped, sterilized, and used safely across a vast range of clinical tasks. Plus, plastic itself is a low-cost material, and with the healthcare systems across the country and even across the world feeling overwhelmed, often due to limited budgets but growing needs, plastic materials are a highly attractive option. And the effect of all of this is compounded when we actually look at the history of clinical practice and the way procedures have been done over the years. One time, plastic use is embedded into behavior because it is often associated with sterility. And that association itself can be accredited, at least in part, as to why the healthcare sector uses more virgin plastics than any other sector. So when we look at where plastic exists in healthcare, they're virtually everywhere, ranging from packaging to devices to the items that are worn, to some specialized coatings of pills that patients take. Even the acrylic or the latex-based paint on the walls of the hospital can contain plastic. So the list goes on, and by correlation, the waste keeps piling and piling. It has piled up actually to the point where in 2023, across Europe and North America, there was a total system emission of 9.3 million tons of carbon dioxide equivalent just from single-use healthcare plastic. And Eunomia and System IQ just released a report this year titled Prescription for Change. And this report is the first of its kind, exploring the global depth of this problem. And it focuses on advancing the circular economy by providing a roadmap of evidence-based strategies for change. And the reason why this report has become such a prominent part of the conversation so quickly is because the project, they project that without urgent action, hospitals across the United States and Canada could reach 3.6 million tons of CO2 equivalent per year in 2040. And in 2040, they could be facing up to $37 billion each year in plastic waste management costs, which is a 28% increase over today's expenses. So not only is it costing the environment, but it is costing a significant amount of money that could be diverted to providing direct patient care or infrastructure support. And the costs continue to rise because the environmental output is actively accelerating global carbon pricing, which then requires tighter climate regulations. And just for transparency, the Circular Clinical Care Project Advisor, Linda Barangu, and myself, the project manager, are listed as contributors to this report as we provided insight into the Canadian landscape, using data from previous and current Canadian Coalition for Green Healthcare projects. And this message can be further reinforced, though, through the Lancet that has published papers this year with the same message that single-use plastic waste in healthcare is a topic of urgent concern, continuously highlighting that plastic pollution is caused by human activity and that there are human health risks at every stage of the plastic life cycle, which is why matter matters, because less than 10% of this matter is recycled. And essentially, all of the actionable steps and future research goes back to the need for an interdisciplinary collective response. In 2020, a report from the University of British Columbia gave a general estimate that plastics account for approximately 30% of all healthcare waste in Canadian healthcare systems. which just further emphasizes a need for change. When we zoom into the plastics and observe the chemicals of concern, there are over 13,000 monomers, and more than 3,000 of them are of concern to human health, according to the United Nations Environmental Program. And these chemicals of concern, however, are translated into medical devices that we have that are directly used to provide patient care or to treat medical conditions, and using things such as implanted devices. And whether plastic is introduced directly into the body system or not, microplastics and nanoplastics will find their way in. They have been found throughout the human body, and we are starting to learn that they can cross the placenta and blood-brain barriers. And basically, they are influencing all of the major physiological systems. Food and water have been thought to be the main exposure route, but new research highlights that they could also just be inhaled from air pollution. Recent studies have shown that we inhale up to 68,000 plastic particles per day, which equates to the average person having 7 grams of microplastics in their body. So when we multiply 7 grams by Canada's population, which was estimated at 41.4 million people on October 1st, 2024, the math shows us that the human bodies of the people living in Canada are essentially vessels that are carrying a combined weight of 290,000 kilograms of microplastics. And really, that's why we need to take action. So, recognizing the problem, this led to the launch of the Circular Clinical Care Project. So this is a 3-year project being undertaken with the financial support of Environment and Climate Change Canada. And if I had to just summarize the project in a few words, I would say that we are an interdisciplinary team committed to sustainably reducing single-use plastic waste in healthcare across 4 areas that we have identified as hotspots for plastic waste. And we have 3 partners. Our pilot partner is Hamilton Health Sciences, which is a network of hospitals in Hamilton, Ontario, Canada. And it is the only hospital system in Ontario that cares for all ages from pre-birth to end of life. And they are a world-renowned hospital for healthcare research, which is correlated to their collaborative relationship with McMaster University. Especially with the School of Medicine, which is a full project-long partner of the Circular Clinical Care Project. Within the School of Medicine, we have specifically partnered with McMaster University's postgraduate medical education, which is the program where Dr. Sargent leads the sustainability stream. And we collaborate with medical residents. Just for clarity, a resident has their MD, their medical degree. So they are doctors, but they are now training into their specialty. And so we collaborate with them to implement quality improvement projects in the hospital. And we also have a project-long relationship with Peach Health Ontario, which is a collaborative group based at McMaster University Department of Family Medicine, but their work actually does span across Ontario. And in terms of this project, they specifically support us with our knowledge translation work. And so at this point, we are 12 months into the project, and we are starting to transition into a national campaign, which ultimately we are touching every major section of the hospital, really. We have numerous projects underway for each category, which we are exploring throughout Plastics Reduction Week. So tomorrow we will be exploring deeper the projects related to inpatient nutrition and general cafeteria services. On Wednesday, we will cover the initiatives we are doing related to textiles. On Thursday, those that are related to pharmaceutical packaging, including the reduction of IV bags. And then on Friday, we will focus on perioperative care. So from these four categories, these are just six of the projects going that we are undertaking. So just going around the ones listed on the screen, the projects range from direct IV pushes to reusable masks to bringing your own bag for day surgery, replacing the orange plastic medication vials to glass vials, to exploring interdisciplinary ways of treating urinary incontinence and switching from sterile water to tap water for endoscopy procedures. So again, these are just six of the projects that we are pursuing during the pilot year, but there are many more implementation opportunities. And so at this point, I will pass it to Jacqueline to explore just general strategies for implementing changes and opportunities for plastics reduction she has explored with her Reusables First team.
Thanks so much, Sandra. Just give me 1 second to share my screen. Hopefully everyone is seeing the right screen. Okay. Great. So yes, hi everyone. My name is Jacqueline McNeil. I'm delighted to be here today as part of Plastics Reduction Week, as Opportunities Day, to share about Cascade's Reusables First work. I was the lead on the Reusables file, so I'm just very excited to be a part of the discussion today, and just want to thank Sandra and the rest of the coalition for inviting me to speak. So without further ado, I will get started. In case there's folks on the call who aren't familiar with Cascades, I just wanted to quickly share that we're a national initiative, and Cascade stands for Creating a Sustainable Canadian Health System in a Climate Crisis. We have 4 core partners from across the country, and we're funded by Environment and Climate Change Canada. And one of the main pillars of our work is to develop implementation-ready resources, and that is where the Reusables First playbook comes in. And so this playbook was published earlier this year in May, and it was developed in partnership with Vancouver Coastal Health. And it really draws from their experience of implementing a reusables first approach as part of a broader move toward a sustainable procurement program that they have been and continue to work on and work to. And although it really pulls from their experience, again, from that kind of procurement perspective, we really wanted to create a resource that really highlights information and case examples and recommended actions that are relevant to a broad audience. So folks in different care settings, in different roles. So that is the aim. And then just to make sure that we are all on the same page in terms of what we mean when we say reusables first. So this is a sustainable approach to healthcare procurement that prioritizes the purchase of reusables or reprocessable products over single-use disposable items whenever possible. But it's also coupled with the active strengthening of reuse systems. So this can be reprocessing, remanufacturing, or redistribution. So before I tell you more about what is actually in the playbook, I just want to take a minute to flag the development team. And so I was the lead author, but I could not have done this without all the folks on this screen. From the Cascade side, we have Dr. Fiona Miller, Brittany McGuire. From Vancouver Coastal Health, we have Colin Chan, Marianne Dawson, Andrea McNeil, as well as Emily Chin. They all drove this work and were absolutely integral to the content and its publication. So very grateful to all of my colleagues here. And just to give you a little bit of insight as to the development of the playbook. So in previous years, Cascades had an RFP process to develop new playbooks and resources with our community partners and collaborators. And so Vancouver Coastal Health, or VCH, submitted an RFP, and it was approved and initiated in December of 2023. And so we began drafting a first version from January to April 2024, and it really was heavily influenced by the VCH experience. We then moved to a stakeholder review phase, and in this phase, we really realized that we needed to kind of broaden the scope and so that it's like beyond the procurement perspective. So we kind of went back to the drawing board. We did some further research, developed new content, and did a bit of redesign. And then we moved again back to a review process. So this involved two different groups. We kind of had a core stakeholder review group, and then we had a working group where we invited, or we folks that we engaged with from across the country. Were gracious to review and provide their feedback. And then from there, it was all the revisions were finalized and it was translated into French and English, as all of Cascade's resources are, and it was published in May of 2025. And then we are planning to do a first official update in early 2026, and I can share more about that later. And just to give you a sense of who the folks are, I think there's a few folks in the call actually who were part of that working group of reviewers. And yeah, we had 18 experts from across the country, and we were very grateful for their feedback. And so to tell you a little bit more about what is in the playbook, so like all Cascade's resources, it follows a why, what, and how structure. And so the why section really provides the case as to why reusables and a reusables first approach is a high impact opportunity to advance sustainability. And then the what section really provides a bit of an overview of different reusable opportunities across 4 action areas, and I'll get into those in a few minutes. And then the how section provides a bit of an overview of suggested strategies on how to implement reusables or adopt a reusables first approach long-term at a site or organization. And excuse me, I just need a glass of water. And then one of the other novel things about the playbook is that there are these kind of key recommendations flagged throughout. And these are us trying to highlight the kind of key actions or strategies that we think are really pertinent to help advance a reusables first approach at an organization or site. And so now I'd like to kind of walk you through each section and just highlight some of the kind of key examples included within the section. So in the why section, the case for change, again, we're trying to make the case as to why this is a high impact opportunity to advance sustainability. And so we situate reusables within the broader context of sustainable procurement. We talk about environmental and social impacts of single-use disposables and highlight co-benefits and key considerations for reusables. We touch on reprocessing and what that kind of looks like in different settings. And then we also showcase healthcare sector action towards sustainability and reuse. So we highlight international and national momentum for sustainability and reuse. So then in the what section, as I mentioned before, we decided to focus on 4 key action areas, and that is medical textiles, clinical supplies and devices, food service wares, and furniture. And so within each of these subsections, you'll find a summary table of opportunities. You'll find spotlight reusables or key opportunities. And these are pulled from the literature. They were highly referenced in the literature, or we saw a lot of uptake from sites across the country. And then finally, also within each of these sections is a variety of case examples, primarily pulled from the Canadian context, but there are some international ones as well. And so just to give you an example of what those kind of summary tables look like, this is the one for the medical textiles section, the clinical supplies and devices, the food service wares, and then furniture. And to show you what that kind of reusable spotlight or key opportunity looks like, for the medical and textiles section, we decided to focus in on reusable gowns. And so each key opportunity like this will have a bit of a description of the opportunity itself. It will have a list of key considerations, so things that are important to keep in mind that may impact the success of moving such an opportunity forward. And then we also include implementation resources to kind of help guide folks who are hoping to implement. And then we also include a variety of experience spotlights. So these are examples of folks across the country who have implemented a reusable. And so for the medical textile section under reusable gowns, we showcased the program expansion of reusable isolation gowns at Island Health. And there's a variety of these throughout the playbook. And then for the how section, so this is the last section and it goes into strategies for change. So these are strategies on how to implement the change long term. And within this section, we have three areas. So we have the strengthen reuse systems, learn by doing, and then drive change through demand. And so within each of these, you're going to find, similarly to the what section, you'll find an overview of the strategies. You'll find a list of key considerations, key collaborators, and then suggested steps on how to begin the implementation, as well as a variety of case examples related to that strategy area. And so I just quickly want to take a minute to show you a couple of the examples within the how section. So under strengthen reuse systems, mobilize reprocessing, learning by doing, trial a reusable opportunity, and drive change through demand, adapt policies to prioritize reusables and sustainability. So as the name suggests, this section really focuses on actions on how to strengthen reuse systems, and it spans reprocessing, remanufacturing, and redistribution. And so within the mobilize reprocessing, we focus on, or we have two actions listed, and that's to strengthen the capacity of in-house or on-site reprocessing. But we recognize that this isn't a strategy that will work for every site or every organization. So we've also included consider adopting reusable product service systems, which is more of an external strategy. So this is what that page looks like in the playbook. So we have a bit of description here. As I mentioned before, there is a list of key collaborators. So these are folks who are important to maybe bring on board, or you'll need to get buy-in to get the ball rolling on this approach. We also have a list of key considerations. And then we also included suggested steps on kind of how to approach the implementation. And then to show you an example from the Learn by Doing section, this whole section is really trying to provide guidance on how to trial a reusable opportunity. And so this is an example of what the page looks like. There are many considerations listed in this section, but we also include a lot of different tips. And these are things that you may want to integrate into your approach. And just to say that these are 100% pulled from folks on the front lines who have attempted or have successfully implemented a reusable at their site. And this is just an example of the steps. And then finally, the drive change through demand section. So this area is really trying to emphasize the importance of collaborating and working with others to advance this work. And so we have two kind of suggested actions in this section, and it's to adapt policies to prioritize reusable sustainability and to leverage purchasing power where possible to help shape the market. And so just to show you what the policies look like, this section really talks about how talks about different ways to embed sustainability considerations. And so we talk about procurement policy, product use policy, quality improvement plans, and others. And then finally, we also, the kind of key recommendations that I highlighted earlier, we do provide a summary of those at the beginning of the playbook. And again, these are just flagged actions and strategies that we think are helpful to try and advance a reusable first approach long term. And they are recommendations. They will not work in every context. They won't be suitable for every organization, but we do think they're important to flag. So you can find those at the beginning of the playbook. And then just in terms of next steps, as I mentioned before, we are planning to do an official update in early 2026 to include new research that has come out, new tools and resources. We are also always looking for new case examples and resources from the community. So if you have adopted a reusable at your site, we'd love to hear from you. And we're also continuing with our Reusables First webinar series. We do have one, the next one coming up on December 3rd. So if you are interested, please join us. And I just want to say thank you for your time and attention. I know that was a lot of information, but I hope this playbook overview provided you with a bit of a sense of some of the different opportunities that are out there. But there are many others that are not included in this playbook, and I will pass it over to Tipu to share a little bit more. Thanks.
Thank you. Are you able to see my screen?
Yes, we can see it.
Okay, brilliant. Sorry, I can't see you. Hello, everyone. It's such a pleasure to virtually meet you all, and I'm so excited to share about our repository, which I like to sort of call the whiteboard of our work, filled with over 250 sticky note style ideas for reducing single-use plastics in healthcare. My name is Tibu, and I am a research associate at the Coalition. I have an academic background in interdisciplinary science, clinical research, and global health. And as part of my work, I primarily support with the development of business cases and case studies for the Circular Clinical Care Project. I also help to centralize ideas for circularity and plastic reduction that we come across, and there are many. And so the repository was created as a tool to help us track and organize these opportunities. I've portioned today's section into 4 parts. Part 1 covers the scope of the repository, including how it connects to the project's 4 core categories. It also covers the healthcare plastics landscape, just as a recap of Europe and North America, and introduces key concepts around polymers and examines how current estimates influence the projected impact of our work. That involves items from the repository, of course. And in part 2, we will discuss our methods for finding new ideas, and we'll briefly go over the list's format and legend. And in part 3, we will look at items within each category of the repository. We will highlight some items on that list that we will discuss throughout Plastics Week. This part concludes with an overview of our selection criteria, which is one of the many considerations that the project team makes when choosing to undertake an initiative from that list. And in part 4, we'll discuss our approach to quantifying plastics and emissions reduction impact across selected initiatives from the repository, right? So that initiatives that we take from the repository and actually undertake and create business cases and case studies from how we quantify our impact to reducing plastics and emissions. And so if you have any questions as we make our way through, please feel free to put them in the Q&A. And let's start with the scope. I'll walk you through what the repository covers, how it's structured, and why it matters. When identifying opportunities for reduction and reuse, we categorize these within 4 project themes, which include perioperative care, textiles, packaging, and food-related services. And if we come across an item that doesn't clearly fit into one of these, but still has the potential to meaningfully reduce single-use plastics, we add it in and classify it as miscellaneous. Every item in the repository contributes in at least some meaningful capacity to reducing the weight of single-use plastic waste in a healthcare facility. This is a guiding principle, and it gives us the flexibility to include a wide range of ideas, from which 3 observations are apparent. First, we found that ideas often span multiple categories, like how reusable surgical masks, for instance, can fall under both perioperative care and textiles, or that ideas can fall outside traditional boundaries, and we'll cover one of them in this session. Second, that innovation sometimes emerges in unexpected areas, especially when championed by a motivated changemaker. And third, even a small change, it could be a drop in the bucket when it comes to healthcare spending, can have considerably measurable impact when scaled nationally. This approach helps us stay inclusive and responsive to new ideas while still maintaining a clear structure for how we evaluate and organize them. To ground the repository, our working list of ideas, in meaning, let's briefly revisit what plastics are, why they matter in the context of healthcare, and why reduction and circularity initiatives are important. While used widely, healthcare plastics are still contributors to the global implications of plastic waste. Like we mentioned earlier, between 1950 and 2017, about 9.2 billion tons of plastics accumulated globally. That number continues to grow, and it's only exacerbated by mass production of items across all industries. And the healthcare sector is no exception. A report found that less than 5% of healthcare plastics are recycled across North America and Europe. And as I virtually stand in front of this graph, we're on track to exceed 1 billion tons of plastic accumulated globally in the next 25 years. Healthcare has a unique opportunity to lead on this issue. According to the 2023 Systemic and Unoma report, which Sandra mentioned, with contributions from our project manager and advisor, Linda Varengu, both reduction and circularity have big savings potentials across life cycles. These plastics costed the system an overall approximate $56 billion in 2023 alone. And projections show that if we don't change course, the weight of plastic waste, greenhouse gas emissions, and associated costs are expected to rise by at least a third over the next 15 years. In other words, the environmental and economic impacts of single-use plastics in healthcare are only going to intensify if we stay on the same path. So let's chart a different course. The repository is a collection of practical, vetting-ready ideas aimed at reducing single-use plastic in healthcare. Single-use plastic waste and use in healthcare. By understanding the scale and source of plastic use, we're better positioned to support healthcare systems in making this change. In the next section, we'll walk through the methods we use to identify potential solutions and how we've built the repository as this working list of ideas. We find initiatives from three categories of sources. First, from local experiences and expertise. We begin with insights of healthcare professionals, including nurses, doctors, and pharmacists, to identify sustainability initiatives that are already happening, but we might not know about as prominently. For example, the Choosing Wisely initiative at Hamilton Health Sciences, publicly available resource if you would like to read about that. They reduce unnecessary tests and treatments, and while primarily focused on clinical appropriateness, this also leads to reductions in single-use plastics. And when quantified at scale, efforts like this can become compelling models for broader adoption. And it also goes back to an earlier idea that innovation can come from ideas where we don't actively anticipate it to, in this case, from lab work. Second, global collaborative forums. I had the privilege to attend the Sustainable Quality Improvement Showcase in May, where I learned about exciting sustainability work happening across Europe and beyond. One example came from Alberta Health Services in that showcase, which we'll discuss in more detail on Thursday. And while Europe is far ahead in healthcare sustainability, that's actually a strength for us. We can cite their expertise, learn from their progress, and adapt those successes into our own context. Lastly, we scan both peer-reviewed research and gray literature. On the very right of this slide is a screenshot from a study by Rizan and colleagues showing a typical adrenotonsillectomy procedure that generates 101 single-use plastic items. Studies like this help us understand the scale of the issue and highlight opportunities for intervention. So let's see this list in action. Presently, the repository exists as a working spreadsheet in draft form. We organize entries into 3 columns: the category it fits into, a description of the initiative, and circular clinical care, or CCC notes. These are internal reflections or flags from our team under the project. These notes help us to think through scalability, readiness, or follow-up actions, and they also help guide our internal prioritization process. Here's how to interpret the color coding used in the repository. As we continue to develop this working list, which currently contains over 250 ideas, each category has been given a label and a color. This helps us quickly scan for intra-sectoral ideas and organize them thematically. All initiatives in the list have traceable sources that are tracked. Once finalized, the repository will, of course, include clear hyperlinks so that every entry remains transparent and verifiable. Now that we've seen how the repository is organized, let's explore a few highlighted examples, one from each category. In its entirety, each listed item isn't a finalized topic for a business case or case study, but they give us a sense of the kinds of opportunities that we're tracking and how they could contribute to reducing single-use plastics in healthcare. Let's begin with packaging. This is a category that's super diverse, spanning from pharmacy items to material-efficient alternatives in other hospital areas. The examples shown on each slide are potential opportunities. Again, they're not necessarily implementation-ready items, and those marked in yellow reflect particularly promising ones due to their broad use, reduction potential, or traction at other sites. In particular, medication administration pathways are an area that we are exploring, and we will hear more about this topic on Thursday's session of Plastics Week, when another health system, Alberta Health Services, shares how it reduces plastics and saves costs through this initiative. Next, we turn to textiles. This category captures opportunities to shift from single-use to circular or extended life items, such as gowns, linens, and scrubs. Many of these items have emerged from both internal experience and external examples. The yellow highlighted entries are those with especially high potential based on use volume, supply feasibility, or existing clinical interest, existing implementation pathways that we can learn from. I'm currently reviewing pilot data from our site to help us refine how we prioritize these, and hopefully I get to use my highlighter on this list in particular once that analysis is complete. On Wednesday, we'll hear from a site that implemented a reusable Buy Canadian, a Canadian-sourced textile product, and how they navigated that process. Perioperative care remains one of the largest contributors to single-use plastic waste in hospitals. Ideas in this category are informed by clinical workflows, research evidence, and global health system examples. The yellow highlighted items represent initiatives with frequent use, high reduction potential, or early success elsewhere, piloted at a different site or within the literature. We'll be exploring one of these, the use of tap water in low risk and non-sterile gastrointestinal endoscopy during Friday's webinar, where we will talk about Canadian champion organizations that led this work and how we are following this at our pilot site. We'll also walk through a business case, which won't necessarily be endoscopy specific, but we can certainly talk about calculations and methods for quantifying reduction across almost any initiative that you might be interested in, even if it isn't listed here or even if it isn't a topic of this week. Finally, turning to food-related services. This will be our webinar focus tomorrow, where we will revisit 6 of these in more depth. This category includes opportunities across patient meals, retail food spaces, and packaging associated with food delivery, as well as with bulk food delivery. The repository currently includes a wide range of ideas in this area, supported by both internal observation and examples from external Canadian organizations. We'll revisit 6 of these tomorrow, and if you're interested, I'll bring my highlighter in case you'd like to help us make one of these a pilot. And finally, facilities are orange, and the miscellaneous category is gray. It's a catch-all for ideas that don't fall neatly into the others, but still align with the project's goal of reducing single-use plastics. With such a wide range of ideas in the repository, not every initiative becomes a project. So how do we decide what to move forward with? At a high level, we use 11 guiding prompts to help assess which ideas are most worth pursuing based on environmental impact, cost savings, scalability, and feasibility. We start by asking, does the item target one of the most commonly used single-use plastics? Now, how do we know this? We look at global lists, local lists, but it's not necessarily a rule-out category. We conduct a holistic assessment of our pilot site as well, and we also ask, does it fall into one of the 4 project categories? is there a way that we can reasonably document assumptions to make it work if it isn't directly related to one of those categories? What helps us is that these categories are flexible. For example, something under dialysis might also be considered under perioperative care instead of just packaging, depending on the context. And then we look at patterns of use at our pilot site. What's the total volume of use across the hospital? How frequently is it used in certain departments? And this is important because change in a hospital takes time. As I've learned, when you want to implement a change, you need to be strategic with the type of change that you implement. You want to focus on initiatives that have high impact and are reasonably scalable within the system. And so we evaluate potential benefits, like what are the projected cost savings and plastic weight reductions, and we also critically appraise how we quantify these. We also consider whether there are existing life cycle assessments in the academic literature that support the idea's impact, and whether this change could improve supply chain resilience, for example, by sourcing from Canadian manufacturers. Finally, we assess feasibility and readiness. Do available alternatives meet healthcare safety standards, and can we reasonably justify process changes through the medical literature with advice of healthcare professionals? And are alternatives clinically validated, or have they been used successfully in other healthcare contexts? We also consider whether the solution is scalable to other departments, workflows, or procedures, and importantly, whether there is existing interest or support from among clinicians. I also make sure to consult with professionals and diverse sources to ground resulting business cases and case studies in evidence, context, and sound and replicable insight. Once we decide to undertake an initiative, we make sure that our reduction quantifications are rigorous and credible, our approach is replicable, all calculations are transparent and independently verifiable without relying solely on sort of internal sources. They're conservational in that we use low-end estimates for reduction to remain transparent and avoid overstatement. And lastly, they're grounded. All estimates are based on multi-layered research and documented processes, ensuring that we are audit-ready and evidence-based. And to conclude, to support implementation and decision-making, we include a table like this in each of our business cases and case studies. This particular example is from the reusable surgical masks business case, which we'll explore more on Wednesday. It outlines the polymer involved, how we classify the unit of measurement, and the estimated reductions in plastic waste and carbon emissions. We also provide a scaling method so that facilities can estimate what the impact might look like within their own context. These tables, the one on the slide, help ground these ideas in quantifiable outcomes and are a critical part of the repository. Thank you so much for your time and attention, which I greatly appreciate. I look forward to the conversations ahead and to continuing this work together toward a more sustainable healthcare system.